Ontario is investing heavily into mental health. Some of the money is going to be heading here into Western and Northern Ontario, specifically into Thunder Bay. Money will be going to the district jail. We sat down today with the Minister of Mental Health and Addiction, Michael Tibollo, and got some details. Here's the information. It's James with Net News Ledger. We're continuing our COVID-19 coverage, and today the Ontario government made an important announcement about mental health, and it's probably very, very timely. Minister, just to share with you, we have breaking news in Thunder Bay. There's just 21 new cases announced up here, bringing the total over 50 for the number of cases that we've got. And one of the issues that we're dealing with heavily here is mental health. It's critical. So first of all, what's specific in today's announcement for Thunder Bay and then for the rest of the region?
Well, the announcement today was for $37 million, really for the justice sector in terms of investments that we're making in the province. And what we're trying to do is to create a connected system to provide supports to individuals regardless of where they are or who they are in the system. So for us in the justice sector, we know we need to do more. I'm not sure if you know, but I was the Minister of Community Safety and Corrections. So I've visited actually of the institutions that we have in the province, the corrections institutions. I visited 14 of them. I've also had the ability to go out with numerous police services around the province, including Thunder Bay. I visited the Thunder Bay jail, and I recognized then, as now, and as in my capacity as Minister of Mental Health and Addictions, the need for investments in the sector to provide more supports. So the first investment relates to the mobile intervention crisis units and the importance of providing individuals in need of supports access to services. So that was the first, and we've seen that throughout the province where we've made these investments, it's had a positive impact on supporting individuals with mental health and addictions issues. In addition to that, and through the justice system, we recognize that the whole purpose behind a corrections facility is to provide supports to help correct behaviors, to help provide support so that an individual isn't going through a revolving door and returning to a corrections facility. So we started with looking at enhancing programs within the corrections facility. So part of the investment of the $37 million is $4 million specifically directed to that. We also know that an individual, when they come through the system and come out, they need to have supports. So peer-to-peer supports are extremely important. We've decided to invest $2 million into peer-to-peer supports, which again is fundamental to the success. And there are all kinds of studies, peer-reviewed studies, that support that a peer is the best person to provide supports to an individual who's had experiences that have impacted on them to bring them to the justice system. In addition to that, for vulnerable and marginalized people, through the Ministry of the Attorney General's Justice hubs, we are also investing $1.1 million, with one center being placed in Kenora to support the North. And so, in addition to that, we also understand that we have to look at the social determinants as they relate to mental health. And one of the things that you have to have is housing. So there's an investment specifically designated through the justice system supporting individuals with housing supports, and that's another $14 million investment. I mean, for us, regardless of where you are, and I think, James, you understand that the roadmap to wellness that was created in such a way that it looks at a lifespan of an individual, looking at each portion of a person's life and focused on providing supports to the individual. What we then did was look and say, well, how is this province going to be broken down into Ontario health teams, and how we'll be able to provide step care models where individuals can get the support they need where and when they need it. Then we looked at the whole system and said, well, we've got to deliver culturally sensitive services as well. So a person who's going through corrections is not necessarily going to be the same person who's living in the community, or an Indigenous person, or a Black individual, or a Francophone, or someone with neurodevelopmental disorders. So it became very focused. on also trying to understand the needs of the different individuals and what their life experiences are in the lifespan that they're now living, to ensure that we can provide services that are connected and integrated so the individual has the best chance of succeeding, and we reduce recidivism rates, we reduce the need for someone to return to the justice system, and basically change the whole way we look at mental health in the province of Ontario.
Now, what we're getting in Thunder Bay, and we've got instances where, people are in the correction system in the Thunder Bay District Jail. Gang activity seems to be continuing there. We're getting a lot of people in Thunder Bay who are coming up here from Toronto, getting arrested, being told they can't be in Thunder Bay, returning to Thunder Bay to continue doing business as usual, for lack of a better term. And in the jails, there are people that are getting attacked, that are getting beaten. There's things happening in there that, you know, we're back in Jean Valjean days where the prisons were awful, and Thunder Bay is a prime example. How do we get into the actual corrections facilities to start making this happen with the conditions, say, we've got in Thunder Bay? And I would wonder how come we'd be putting a unit into Kenora when Thunder Bay is really the main center with the problems here in Western Ontario.
Well, we've had when I became the Minister of Mental Health and Addictions, I came to government not because I wanted a change in my career path. I was actually practicing law, and I was very much engaged in mental health and addictions, running an addiction center in Southern Ontario. And one of the things I recognized is that there had been very little to none in the way of investment in mental health. Mental health was seen as the orphan child of the healthcare system. There wasn't a table where mental health was discussed. It was always secondary. So I came looking for a way to fix the system, to put investments in place. And one of the things that attracted me to politics was the fact that someone finally started saying, we're going to invest $3.8 billion. We're going to revolutionize the system. We're going to put that money and we're going to build a system that's going to be completely transformational on all levels. And that brought me to government. And then I got here, and the first portfolio I got was corrections and community safety. I traveled around to the different institutions that we have, and the ones that I got to see, I used to always ask myself the question, what are we correcting here? What are we doing to make someone's life different so that we can help them, get in a lane that's going to make them succeed in life? And I started seeing the lack of supports that existed in the system. And I started to see that we needed to do more. We needed to invest in mental health, and so we started from when we came into government, looking at different situations. Now, you talk about Thunder Bay, one of the most beautiful cities, and I speak to your mayor about this every time I want to help you. I want to do more in Thunder Bay. I was up there, I've been there several times now, and it's a jewel, but it needs help. It needs help desperately. And the help that it needs is, I visited the Thunder Bay Jail, and I have to say to you, I can't agree with you more with how you described it earlier today. And to me, it was a very difficult situation as well, because having been in policing and in community safety and corrections, I also understand the way the guns and gangs work and how drugs move into the far north. And the makeup of the jail up there is really a statement on what is happening in terms of movement of drugs and crime in the province of Ontario. So I got a chance to see and work to develop a response to that. And what we're trying to do, again, because of the vastness of the North, is figure out a way to connect pieces that work and to provide the best services we can. In a step care model, we need to do more up that way. But that investment, that $4 million investment, is our first step. And that money will go directly into the corrections facilities and support the work with individuals to make sure that the individuals are getting the supports they need to change their lifestyle. I also know that there's a large portion of Indigenous that are in the corrections facilities up there and that are also suffering with addiction and mental health issues. There's investments coming, and I can't, there's a $176 million investment that's being made in addition to the 174. I haven't completely released or announced all of the 176, but there's a portion, a good portion of that that's going into Indigenous to give them better supports. There are
Now,
investments in the corrections facilities to provide the people the tools they need so that when they get out, they've got a better chance of succeeding.
now one of the my favorite processes in this is the best thing to do is prevention. So what can be done so that people don't end up getting into jails? I mean, a few years ago in Thunder Bay, the survey the city did had youth centers at the top of the charts for everything we needed. And, you know, if youth are busy, you know, and we're having a growing problem in Thunder Bay with drugs and drinking and gangs and crime. And if youth are busy doing stuff, I mean, when I was growing up, I wouldn't have had time to do anything because I was always doing stuff. And it seems in a lot of cases that, you know, there isn't enough prevention. And now we are having to fix a problem that's in the system. But how do we now move as well in your portfolio to, hey, you're not ever going to get in that system because you're going to be, you know, your goal is going to college, it's going to university, it's learning a trade, it's learning a job, it's living your dream. That, you know, is the missing piece of the puzzle sometimes. What would you comment on that?
Yeah. So James, and that's again a very good point. You've obviously done your homework. The issue that we have is that, and if you're in my position, we could develop the lifespan model. So what are we doing prenatal to assist mothers in ensuring that they have the right nutrition for their unborn child to ensure that they have the best chances of their neurodevelopment? That's critical, and that's something that needs to be looked at. When a child is born to the age of 12, what supports are we providing them in the school to build resiliency, coping skills? What are we doing for kids from the age of 12 to 24? Because during those years, there's the balance of the developmental stages are being completed there. The person becomes, their prefrontal cortex is fully developed by age 24. So we're looking at what do we do there, and so on and so forth, all the way through the lifespan to 65 and over. But focused on children, which is the question you asked me, you have to start thinking, what do we need to do in the way of education and prevention? So we have to look at what we're doing in the schools. We invested $27 million into additional mental health supports within the school. We then, because of the pandemic, put another $10 million into that. So we're at $37 million with healthcare workers in the school system. In addition to that, we experimented and developed youth wellness hubs for the youth so that they have a place to go and they can get the supports they need to become successful at what they're doing. We're providing basically in this area, we've provided $85 million of investments for children and youth. Now, the thing that I keep on saying, we're making all these investments, we've created this plan. I am anxious, very anxious to see everything kickstarted and see everything come to fruition, but it takes time. It takes time to embed the programs for education and prevention. You're only going to see the outcomes. I mean, we know 70% of all mental health issues could be diagnosed and treated, and they develop during child and youth. So our investment is looking to identify, assess, and treat as many of those. But we may not see the outcomes for 10 or 15 years. We know we can reduce addictions by 25% by building resiliency, coping skills, mindfulness, utilizing motivational interviewing, utilizing therapies that we know work early on. We can reduce addictions by 25%. The investments are being made, and they're being made for the first time, not politically, but for the fact that we know that this is what we need to do to be responsible to ensure future generations have supports. But James, I gotta say to you though, in my shoes, on one side, I've got to look at education, prevention, and making sure that we build resiliency in our young people. On the other side, I've got to build capacity because the system, the governments of the past have failed us miserably by not investing in these things. You look at our corrections facilities, the first question I ask myself is, what are we correcting? Zero, nothing. So we need to invest in that. We need to invest in programs, whether they be short-term residential day programs, long-term residential programs, withdrawal management. We need to work to ensure that we're providing a continuum of care, which doesn't exist. It doesn't even exist in Southern Ontario. What we have in the province of Ontario is a hodgepodge of organically grown organizations that are there because you care and you donate money to an organization that's helping your neighbor's child because there wasn't a government that intervened and was providing that support, much the same way I've done it for the past 30 years as a lawyer, where I've actually been giving money to organizations that are doing the work that were organically grown. They're not funded by the government because the government never engaged and provided the support that needed to be there. That's changed. $3.8 billion is not going to revolutionize, over 10 years, is not going to revolutionize the system, but it's going to start crystallizing the access points. It's going to start building the connections. And I already see it now, the collaboration that we're seeing in the province of Ontario. I can't say that COVID, I don't want to say thanks to COVID, but if it wasn't for COVID, it probably would have taken 10 years to build the alliances that we're seeing built now. We're seeing stakeholders talking to each other. We're seeing them engaging with each other. We're seeing it happening with the municipal, provincial, and federal governments. We're collaborating, and this is to the benefit of the people of the province. You know, we developed an ICBT program focused on first responders. We developed an ICBT program to help people over the age of 16. We invested in the Kids Help phone line. We've invested in Bounce Back. We've created a system, virtual, which again, thanks to COVID or as a result of COVID, it accelerated and we have it in place. There's 40,000 people in the province of Ontario. Now, this, of course, flagged the problem that we don't have internet to be able to broadband throughout the province. So we stepped up to the plate again as government, said, okay, we're going to invest, 350, 400 million. There's so many numbers swimming around today in my head, but we're making a substantial investment to build the system because it's almost become a requirement, an essential service to have internet at home. Because again, from an educational standpoint, from a mental health standpoint, from a health standpoint, from a government services standpoint, these are all services we can deliver virtually. And, all of a sudden the people in the North have the ability to access the same services that are being provided to people in Southern Ontario. And that's where we want to go. We want to ensure that no matter where you are in the province, you're going to have the supports you need when and where you need them, especially my focus with mental health and addictions.
Now, that sounds, Minister, that's, again, as I've been saying all day today, as earlier on the Premier's press conference, and I'll say to you, this is a good start. What can be done in the child welfare system? I'm not sure if you're aware of it, but there's a grandmother up here who is on a hunger strike, and she's into into the 40s on how many days she's been on this hunger strike. She has not seen her grandchildren, and the system this has been 10 years going on, and it's got her to this, what my partner, my Indigenous editor, says is an extreme reaction. A hunger strike is a pretty extreme reaction.
Yeah.
And we're trying to dig in on some of these stories, and the official side, especially in the child welfare, is, well, what Amanda got yesterday was no comment, no comment, no comment, no comment. And we weren't asking for specifics on inside of a case, but we're saying, okay, here's a problem. Now, how do we move to solve it? How do we resolve these things? And, it all comes down to mental health, as you said.
Yeah. Is she Indigenous, the grandmother?
Yes, she is.
It's an Indigenous child. Well, we are investing, and in the announcement that we have today, there's $400,000 that's being invested for community safety and the well-being planning for First Nations. Indigenous children and youth has been moved into our ministry now in health. It was formerly an MCCSS. And Indigenous children, what we're doing is what should have been done a long time ago, is making Indigenous people responsible for Indigenous children so that they get the proper care and supports that they need, and not have something imposed on them that perhaps is not what's in the best interests of that particular child. So we're working to try to right as many wrongs as possible. It's frustrating because I hear it in your voice, and I know where you're coming from, that things need to change. I came to government to make those changes, and I'm here specifically because of mental health and addictions, and looking to do what's been needed to be done. And I have to say that since coming to the table, there's 16 ministries, and Indigenous affairs is one of them. Northern Affairs, housing. There's 16 different ministries that dovetail into mental health and addictions. And having someone responsible for mental health and addictions at the cabinet table forces that lens to be on every decision that's made. And you made the comment that it's a good start. Well, it's a start, and that's one of the things that we've seen many false starts in the past. This is a real start. 174 million the first year, 350 million this year, and we're well on our way to putting the money, because again, the difference is that we're not telling people what we're doing. We're reaching out. I mean, I've been to Thunder Bay several times. I've been to Sandy Lake, and to a lot of the outlying areas that a lot of people have not seen and don't understand. And I'm listening to people that are coming forward and giving me ideas and telling me where we need to invest to make a difference. And we're making those changes. We're investing in grassroots organizations. We're building the connections. We're forcing people to collaborate by coming together and giving us a solution that's localized to the needs of that community. And the needs of Thunder Bay are not the same as the needs of North Bay, or the needs of the Sioux, or the needs of another community in Southern Ontario. So I'm focused on trying to build that system and ensure that the connections are there. I visited Fort Williams while I was up there, Red Rock, and several other communities. I spent several days in Thunder Bay to try to get a better understanding of the needs. The Northern Medical School, and what we need to do to create the knowledge base that's going to be the future of how individuals receive care in the North. You're younger than I am, but we've both lived long enough to know that you can't change things overnight. It takes a lot of planning. It takes a lot of, and sometimes going against the grain, because a lot of things that we are doing are outside the box. I mean, I'm imploring libraries to get involved with the Ontario health teams around the province. And people say, well, what's that got to do with health? It has a lot to do with mental health, because you can embed mindfulness and mindfulness programming to the kids that are going into to a library for their storytelling and their reading. We can do that with CBT by including it in the curriculum and allowing the parents to work on the homework component, so that they themselves not only are teaching it, but they're learning from it. That's how we'll build resiliency and education, and make our kids better able to withstand pressures as they get older, and give them the ability to say no to drugs, and to look for other ways, from inside out as opposed from outside in, to stay focused on life and achieving great things. But that means investing in housing, and it means investing in education. It means investing in infrastructure. It means there's a lot of work that we need to do, and the dollars in mental health are being spread. There's a great announcement coming that I can't really get into, but I'd love to sit down and chat with you again on housing, and you'll see that we get it. You can't have someone come out of a corrections facility homeless and not give him a safe bed, or give him a supportive bed if there's a mental health issue, or give him a transition bed to him. Because that individual then, with the skills we hope they learn in the system, will never go back to the system, because they will have a real chance at succeeding outside of the criminal justice system.
This is a massive topic, Minister, and I think you're absolutely right. I think we should be starting to schedule almost a weekly talk, so that we're sharing this information across. Our readership is national as well as local, and we should be doing that, because some of the areas that are so important, and we've got things going on with the grassroots involvement you've just talked about. There's grassroots involvement. So, which groups are there? How do we make sure that there's transparency and accountability, and specifically in child welfare? Because during this pandemic, we've had instances told to us from readers, and it's almost hard to keep up, but we've had families that have been broken apart by childcare agencies, and there doesn't seem to be the healing for the parents. They've got the protection part right. They grab the kids and they get them out of the situation. But bringing these families back together is how we build success for the whole future.
Yeah. Well, this is why, I mean, my background is with addictions. I ran this center for 10 years. And one of the things I learned is I cannot impose on someone a system that I think is going to work for them and expect them to buy into the system. So I've spent a great deal of time with land-based healing for Indigenous communities. And I've studied it and I've worked with it. And to be honest with you, it would work for non-Indigenous people as well if we were able to continue working and creating an evidence-based approach to it. But the Indigenous people invented residential therapeutic communities thousands of years ago, before it was even thought of as a solution to addictions issues. And we need to look more at ensuring that people can participate and provide us the solutions. So when we talk about child welfare, one of the things, especially in Indigenous communities, it's about time we turned it over to Indigenous people to look after their youth. I think they're going to get it right. They're going to do a much better job than we ever could do, because they understand their needs. They understand their culture and their ethnicity. I mean, I look at different systems. Psychology is built on a model that came from North America, well, from England, but mostly the United States, and then it spread to England and of course to Canada. So we use a very individualistic style of therapy when it comes to trying to help individuals. Well, that doesn't work if you come from a collectivist world. So if you happen to be Indigenous, or you come from the Black community, or you're Spanish, or you're Italian, or you're a many number of other ethnicities that come from a collectivist system, there's going to be resistance, which is why one of the pillars of our model is to look at culturally sensitive services and ensure that the people that are providing those services are versed in the culture of the people that they're working with. So we need to train more Indigenous individuals. We need to train more people from the North. Again, bringing somebody from Southern Ontario to the North who's being parachuted in to work for a year or 2 years is not going to give you the same results as someone who's native, who's lived in the area. So we need to use the Northern Medical School. We need to use the colleges, in North Bay and in Sioux, Algonquin, and the other Candor, to train people, but also make sure that they are able to work in the communities that they came from. That's how we're going to be able to deliver culturally sensitive services. That's how we're going to start making a difference. And of course, as we try to balance out investments in education and prevention, as we build capacity, I firmly believe that by shifting our investments into education and prevention, we're not going to need to build capacity anymore. To build a prison these days, it's anywhere between $3 and $5 billion. Imagine how much we could do if that money was being invested in our youth and in the kids and providing them opportunities. Imagine what that would do if we would invest more in housing and supports to give people a real chance if they're coming out of a correction facility, or if they weren't in a correction facility but were coming from a marginalized community where they would never be able to afford a home. How about investing in more jobs and giving people the opportunity to have the pride of working and saving and the pride of ownership? We've got to give people hope again. We have to give
Yes.
people, the ability to, show what they can do themselves. And, human beings are very resilient, and given the opportunity, we will come out of it, and we will, do really well. And, I believe in that. And I believe that there's a lot of positive things government can do to stimulate that initiative or that incentive. But I think we have to instill that hope. We have to provide the avenues for people to be able to do better with their lives. And I think at the end of the day, we won't have to invest in as much as we are now in capacity building, and we can invest more in education and prevention.
One last question, Minister, and I'll let you get back to work. Or
No problem.
this is
I'm
work.
enjoying this, so you can call me anytime.
All right. 3 weeks ago, I was up in Nescandiga. Boil water order approaching 10,000 days. The water plant was built in the 90s. It failed within a year, and for 25 years, that community has been under a boil water advisory. And I was up there several years ago with the federal minister, with the AFN national chief, and with the NAN grand chief. And I did something a little unusual. I talked to some of the youth. And it's, these are kids that are growing up and they've never had a glass of water from the tap. Washing their hands makes them sore. Having a shower turns them into open sores on their body because of the toxicity that's in that actual water, that they're just saying boil it. And I interviewed Andrea Horwath on Friday. I was actually the only media on her conference call. And I don't know what that says about media in the province and the NDP, but my question to her was on Nescandiga, and she said, why would Ontario not treat the citizens of Ontario across the board with the same level of respect, fix the water plant in Nescandiga, send the bill to the federal government, and insist that they pay it? But on a mental health issue specifically, I mean, the kids up there, I was at a bingo here in Thunder Bay for them, held by North Star Air. These are amazing kids. They need that hope. How can we deliver it?
Yeah, it breaks my heart to see the conditions that a lot of our First Nations, the First Nations people are living in. And, the government, I ask that question often, and we've got a great minister. Minister Rickford is amazing, and he's doing everything he can, fighting and lobbying with the federal government. From my standpoint, I get it, and I think a lot of us get it. I was supposed to go up to Saskatchewan and Fort Albany and look at the situation up there. They've been in crisis, emergency with mental health now. I probably as long as our government has been in power. And I spoke to the chief, and we arranged everything. And then, of course, COVID. He caught COVID, and I wasn't allowed to go up there. But there's a lot that we need to do, and we can't do it alone. We need the federal government. When I ask these questions about how we go about doing it, there's jurisdictional issues that need to be addressed, and I get it. Why don't we just fix it and get on with it? And I believe the Ministry of Environment or the Ministry of Indigenous Affairs has sent people up there, so I know we're working on that issue. But I was at Sandy Lake. I went to Sioux Lookout. I went to Sandy Lake. I stopped in Pekanjikun. I've been to very remote communities, and when you see the conditions that these poor people are living in, it breaks your heart. And when you see the conditions that and when I say conditions, I'm talking about the roads, I'm talking about the water, I'm talking about how people are living in a home. And then you come back and you think, you know what, I can make a difference here, helping them with the mental health issues. But if I address the mental health issues and they return to a situation where a household of 7 people, there's 5 that are addicts and 2 that are pushing the drugs, or you go to a place where you can't have, there's no future in the way of work, or you go to a place and then you think, okay, well, where do you start to fix the problems? All of these problems have to be addressed and fixed. And Chief Pelletier in Manitoulin, I've been spending some time with him, and I've gotten an opportunity to see the Wakongan First Nations and what he's doing. And he's a very progressive chief. He's got 15 kids working in a plant in Vaughan Woodbridge, where I represent, and teaching them how to make PPE. And they're making the surgical masks. And these 15 kids are going to go back, I think, in 2 weeks. And what they're going to do is they're going to train a whole bunch of Indigenous people to make PPE locally on Manitoulin Island to supply the province. That, to me, is an incredible initiative. He has an outdoor, I can't remember the name of it now, but I was up there and I met them on an island. And these 15 kids, the youngest one I believe was 12, came canoeing all the way from the French River. And they stopped at different points along the way and visited grave sites, visited some markings that were done by their ancestors. And I sat and I talked to these kids, and I started to see the pride of who they were, First Nations people, proud of their heritage and their background. So I tip my hat to the chiefs that are doing that are fighting to ensure that the next generations of kids are instilled with the pride of the people of this country that were here long before we got here. These are the kinds of things we need to do more of. We have to showcase more of. We have to give the opportunities to the individuals to look after themselves. I really, my concern is always, I don't want to give you the fish. I want to teach you how to fish. Well, in this case, I want to give you the opportunity to show us that you can do it. You've done it. You were here way before we were here. They just need to be given that hope. They have to be given that opportunity. And I know that from there, we'll see the mighty First Nations come forward, proud and resourceful and contributing to the rest of the province and to the country. And what Chief Pelletier is doing in Manitoulin, I would love to support that in Pakanjikum. I would love to support that in Sandy Lake, in Athawapiskat, because those are the kinds of things, what you said before, the resiliency of the kids, that flicker, that flame is in their soul. It's just a question of being given the opportunity to lighten it, and to give them the opportunity to show us who they are. I saw this pride in Thunder Bay, the high school, the Indigenous high school that's in Thunder Bay.
Dennis Camardi.
What an amazing school. What an amazing group of kids. I got the opportunity to meet kids from all over Northern Ontario. And I thought, what, this is what will start to make a difference. But we need to do more of it. We're not doing enough. And that will give people the ability to go back to their communities, hopefully with contacts that are going to want to make investments and to want to do more locally. And that's what's going to build the infrastructure and help, because at the end of the day, the government, it can only do so much. It should do more. There's no question we should be doing more at all levels. And I would love to light a fire under my counterparts federally to get them better engaged in doing more for the people in the North. Because again, we're all proud citizens of this amazing country, and we need to do more to ensure that everybody has access to the same services, no matter where they live in the province.
Minister, I've got so many more questions. I'd like to set up another time that we can talk. I'd like to connect you with our Indigenous editor for another interview, and we'll work with your staff to do that. Because the issues are massive. There's the sexual abuse, there's the lack of listening to the grassroots. There's still so many issues with child welfare. We have a lot to do here. You're on a start. Been saying all day, as I've heard the announcement, we're at, we're getting the go card, perhaps. Do you think the government is standing behind you long enough to get all the support that's going to be needed?
I would say absolutely. Doug, the Premier, has been very vocal about wanting to ensure that mental health is looked after in the province of Ontario. He's given me the opportunity. I'm here. I'm the first minister ever appointed for mental health and addictions in the province. I have the ear of all cabinet. I went to Treasury Board, not to toot my own horn. I went to Treasury Board, and the presentation was 30 seconds. We get it. That was the response, and we were able to. So there's an all of government approach to mental health. All ministries are listening to the needs, because it's been left unspoken for so long that the support is there. We've got another 2 years in our mandate. I hopefully will get reelected and hopefully continue the work that we started. But I'm sure that if we lay a solid foundation, which I think we did with the roadmap to wellness, it's going to be difficult to veer away from that plan, especially if we're investing and with the commitments made for 10 years. We're about $500 million right now in terms of investments. We've got 2.2 billion to go, and a lot of it will come in place over the next 2 years. And that's going to be that's going to be looked at and invested in a way that it's going to give us the best results possible for the people of the province. And we're not investing it politically. This money is being invested for the right reason, which is to ensure access to a system that's connected and providing the best resources possible for individuals in need of mental health and addiction supports.
One area, Minister, Bill C-92 federal. Are you talking to your counterparts at all on that bill?
At this point, the work that I'm doing is really focused on the work that I'm doing with mental health and addictions. There may be discussions at the Ministry of Health level, but I personally am not involved in any conversations at the federal level. I've got to believe that there are conversations taking place about child welfare at the either MCCSS level or perhaps the Ministry of Health. The issue that we have is that there was a change where we took children and youth out of MCCSS and into the health system. What I'll do is I'm going to ask for a briefing so that I've got a little bit more knowledge on the area. I know Minister Dunlop is heavily engaged, so I'm going to assume that she's working on that, and there are investments that have been made as well in terms of child welfare. But I'll get a briefing on that if you want to have a follow-up discussion of it, or I can send you a note if you like, just to give you a little bit more on it. But I personally am not engaged. The other thing with government, we have these federal, provincial, territorial meetings that take place. And I haven't, since the COVID-19 outbreak, they've been very restricted in terms of the issues and the topics that are discussed. So I haven't been engaged in any federal, provincial discussions on that front. My focus has really been $3.8 billion. Where are we putting this to ensure that we build a system that looks after the lifespan, looks after a step care model with services provided best of we possibly can in each jurisdiction, and what do we do to ensure cultural sensitivity to the services that are being provided. So that's really been my focus. And believe me, if you look at the roadmap to wellness, I don't want to toot my own horn or pat myself on the back. That's probably the most comprehensive, best written document anywhere in North America when it comes to mental health and addiction supports. And I'm proud to have been part of the development of it for the province.
Minister, I want to thank you very much. You're seeing my grandson Nation come into the picture, so he's.
Hey Nation, how are you?
Yay. So I'll let you get back at it. Let's keep talking. Let's get this conversation going at full speed.
Anytime, and thank you for inviting me on and for helping me spread the word in Northern Ontario. Northern Ontario is as important, if not more, from the standpoint of ensuring supports up there, because they're long overdue, much needed, and we're going to do everything we can to ensure that they are fully implemented and that the supports are there for the people in Northern Ontario. So thank you for the opportunity.
Thank you, Minister. Have a good day.
You too. Bye-bye.
Bye.
Hey, Nation.
Okay, thank you, sir.
Bye-bye.